All right, testing one, two, three. I am back. I had some audible difficulties, but that's times that happens on live. Uh, on live. So let me just check with my peoples that are out there waiting for me. Testing one, two, three. Going live on this podcast. Testing one, two, three. I can have it going through my ear pods today, so I should be up, up, up. You can't hear me. Okay. Let's see what's going on. My mic is on point. So let's mic. That's weird. Testing one, two, three. Testing one, two, three again. I may have to upload this to YouTube. Can you see me? If anybody's out there, can you see me? That's disappointing. Let me see if I can change the audio. Okay, so some people can see me and some people can't. Okay, so I'll just continue, and I think I can edit from here. So to recap, today's conversation is about avoiding stress. Avoiding stress. The stress that we have. I'm sorry, let me just relaunch it. The stress that we have sometimes on our jobs can result in us making mistakes, us not providing the best customer service, and that's something that we want to try to avoid as much as we possibly can. But burnout is a real thing. I know that when doing certain tasks, we again, have our vision, focused, and we are hunkered down to do great work. But in those times, we should take care of ourselves. We should look at how our schedules are, again, how our family is, if we're spending any quality time with ourselves, so that we can be our best version of ourselves in front of the patients and for the patients. So, have you taken or are you taking that downtime for yourself? Getting a manicure or pedicure, if that's what you like, doing some retail shopping, not too much, but doing something that is, kind of realigning yourself back to the ultimate goal. And I would pose that too is what is the ultimate goal? Um, are we focused on providing the best service for our patients and our customers? Are we focused on being a productive part of the community where we're providing access to healthcare? Mobile phlebotomists do that. I'm going to do an upcoming podcast on how we continue to add value in our local communities. And in doing that, we got to take care of ourselves, right? We have to know our limits. One thing that I would say is to uh, have a end of day process. So it's 4 o'clock or 4:30 or close to 5 on your website. It says that you are available from 8 to 5. But after 5, you're still picking up the phone or you don't have an answering service. You are still allowing patients to reach out to you. Within reason, it is time to turn that over to an answering service or let it go to voicemail. Um, you have to learn how to turn it off so that you can be able to turn it back on at 100% when it's time to go again. Now, of course, there are times where you have to pick up the phone if there's something you've been following throughout the day. There's a customer that just needs your help, obviously, but still have a cutoff time. So that's a part of your schedule is to have a cutoff time for yourself, and that will help you structure out your day, build in quality time for yourself. The other thing that I strongly would recommend is that you build in some type of meditation and quiet time. For those that have a religious base, you can do some reading or spend time with your pastor or imam or your priest, whatever that may be. But I also do some meditation time, whether it's just being quiet and kind of listening to my thoughts. That helps me be more creative. That also helps me be more engaged. That also helps me be more aware. And so a little meditation time, even throughout the day, is really good for you, but especially um, throughout your day, something that drives you to a quiet space. We can get inundated with invoices. We can get inundated with scheduling. We can get inundated with a lot of different things. So make sure that you have some quiet time to yourself. I strongly recommend that you have some level of exercise, whether it's walking, getting up and away from your desk, taking a walk around the block, or stepping outside of your car. If you're fully mobile, that's great, but stepping outside of your car, taking in this new spring air that we have, right? Walking in the mall. There's plenty of places that you can take a moment to get some exercise, rejuvenate your body and your mind. So I strongly recommend that you get some level of exercise. Um, is it a scheduled time to take a day trip, right? So starting out, you may not be able to get away a lot, right? You may have to work tirelessly every day to build this empire that you are creating, and there's nothing wrong with that. I strongly recommend that you have those goals in place, yet also build in time for the downtime, the transitional time. How will you schedule out the next vacation for you and or your family? Set that as a part of your goal. Put that into your schedule. Here it is towards the end of March is the end of the first quarter. For those who follow a quarterly business track, it will be summertime. Are you planning a trip to the beach, for a few hours, or are you planning a cruise, or are you planning a trip to Dubai, wherever it may be? Um, you need to put that into your plans so that you're almost setting some goals for yourself so that you can look forward to an end date for the things that you're doing. um, Communicating with your staff and or your customers to let them know that, hey, July 9th through the 18th, I'll be out of the office, right? I have a secondary person that maybe I need to bring in. One of the things I used to do in my previous corporate and healthcare life was that I manage locum tenens. So those for you who know what a locum tenens is basically a contract person who will come in and sit with or sit for that physician or that nurse practitioner or PA in place of them so that they can either go to a conference and or go on vacation. And so maybe it's partnering up with another person who can take over that space that while you're gone. It doesn't have to be long, right? It can be a short trip. It could be a long weekend. So incorporate that into your workflow because we want to really avoid stress and burnout. So burnout, for those who have experienced it, is that you don't even have the will to go back anymore. Like you're the 9 to 5. Let's go with that because that's more familiar. The 9 to 5 is just worn you out. You're working, you know, eight hour shifts, 7 days a week. Or if you're a nurse, I did that too. I went from working 312s, then maybe a 16, then starting my shift over again. So that can wear you down as well. Having the weekend sometimes isn't enough. You need more time because all the things that you've missed during your shift work has now compiled itself into the days that you have off, and so you're limited on just having a Netflix and chill day or just a relaxation day. And especially if you have a family, those family members will require your time. So build it into your schedule, create a pathway for a stressless, burnout free space. If it's spending time with the boys or spending time with your girlfriends, or if it's going to catch a movie, think of ways to add value for yourself because I promise it will trickle down to your customers. Being agitated, being short, being overwhelmed can be seen in front of the customer or the client. And you don't want to represent someone who doesn't have a systematic way of providing the service. And in that system, build in a stress-free zone. Um, I would love to, trying to jump on the back end. I would love to answer some questions if anybody um, has any questions. Let me see if I can jump on in the back. But this is something that I think about often to make sure that phlebotomists, nurses, allied healthcare providers best, and we can be at our best by having those schedules in place for ourselves so that we can be our best version of ourselves. Um, I'm trying to answer any questions. I see a few people here. Thank you guys for joining. Don't forget to subscribe and hit that notification bell, guys. I want to bring up some subjects that are meaningful for you. How to start a school. I have a great uh, friend and colleague and business partner in CMT. I think she's here, CMT, Carmichael Medical Training, um, building out a option for people um, to start their phlebotomy school. I think phlebotomy schools are a great option as well. There is, I believe it's Mass Mobile Phlebotomy. Mass Mobile Phlebotomy has built out a space where she's become proficient in providing support to clinical trials. If there's somebody who's here who wants to start learning how to do clinical trials in their area, there's tons of groups. There's another group that is starting a weight loss and vitamin injection clinic. So there's opportunities for you to expand your services, and you can do it right here by partnering and connecting with me. I provide a business development and a mentoring group for those that really want to expand on their business. I have some testimonials that will tell you that they have, if not only gained knowledge, but resources and the ability to take their business way further than they ever imagined. So definitely want to add you guys to that list. But um, avoiding stress and the burnout is such an important subject matter. But I'll leave it for the end, guys. I'm gonna end it here today, but more to come. I may even think about putting something out during the week because I have a couple of subject lines that I wanna throw out. Let me know in the comments what subjects you would like for me to cover. I'm not bringing on anybody yet. This is so much information that I want to put out before I bring others in. There's a subject about taxes as an independent contractor and a mobile phlebotomist. There's a subject about, again, expanding your services and what services should you have. I had a great conversation about the value of your time and money. That's another big conversation I'll bring out. So time versus money. You've heard me say it time and time again. Time versus money is important to outline your services and what you're going to charge. So looking forward to building out this phlebotomy on the move movement. And I look forward to seeing you guys the next time. All right. Peace.